Santiago? Steinnorth? Thurmond? Waldron? Wood?
Okay, we have established a quorum. Mr. Breaux, whenever you're ready, feel free to present.
Allowing this committee to revisit the issues facing the community of San Clemente in my district. AB 911 would allow life-saving services to continue at Memorial Care's proposed San Clemente facility under their existing consolidated license. The unique demographic challenges for this region have not changed since this bill was heard in the spring. San Clemente has the Pacific Ocean, Camp Pendleton, and the mountains on three sides. In South Orange County, there are 3 emergency rooms for 250,000 residents. 14,000 new homes are being developed. 3.5 million tourists visit our beaches every year, and there's a daily average of 347 drivers passing through our only road, the I-5 freeway. As Saddleback San Clemente Hospital faces closure, residents and visitors will be without an emergency room between Oceanside and Laguna Hills, a 40-mile stretch down the congested 5 with Camp Pendleton in between. AB 911 would maintain emergency services within the new acute care facility Memorial Care proposes to build on the existing hospital site. I want to offer a sincere thank you to the chairman, Mr. Ridley Thomas, who's not here with us today, and Senator Hernandez. They came down to my district during the break and participated in a forum. And, Mr. Chairman, that really meant a lot to my community, so thank you again for taking the time to come down. As trends in healthcare shift, I hope that healthcare leaders continue to work towards solutions that address the challenges associated with keeping full-service hospitals in operation. With me here today to support AB 911, are Saddleback Memorial Hospital Administrator Tony Struthers and San Clemente Mayor Bob Baker.
Chairman Bonta and members of the Health Committee, hello, I'm Tony Struthers, Administrator of the San Clemente campus of Saddleback Memorial. The shape of healthcare services is changing in California and around the country. At all levels of the industry, patients are moving from inpatient services to outpatient, from hospital-based to community-based care. As a result, small medical facilities are struggling, and in many instances, shuttering entirely. Yet in California, inpatient facilities are intertwined with emergency services. Saddleback San Clemente campus has been facing precisely these industry-wide difficulties with extreme results. Since Saddleback acquired the facility in 2005, both inpatient census and inpatient surgical volumes have fallen dramatically. Our daily inpatient census currently hovers in the low teens and many days drops below 10. Our inpatient surgical volume is also at an all-time low with an average of less than 1 surgery performed per day. For example, in November, we performed only 16 inpatient surgeries, and in December, only 22. These declining trends are consistent locally, regionally, and nationally, placing an already small campus like San Clemente at particular risk. It has become financially unviable to operate the San Clemente facility with so few patients. In the face of this reality, Saddleback must act to transform the aging acute care campus into one that aligns with the community's needs and is responsive to the rapid evolutionary changes occurring in the healthcare industry. After significant dialogue with hundreds of residents, civic and business leaders, and elected officials, we determined that one avenue to meeting the community's needs would be to operate an emergency department under Saddleback Laguna Hills Hospital license. In other words, a satellite ER on the San Clemente campus, and replace the acute care facility with a number of outpatient health and medical services. However, current law does not allow for a satellite emergency department. We support AB 911, which would allow Saddleback to convert the existing acute care campus into a satellite emergency department. We are committed to meeting all of the patient safety criteria that is included in AB 911, and our commitment to quality and safety of emergency services would not be compromised in a satellite emergency department. We are absolutely committed to working with the California Department of Public Health, Orange County Emergency Medical Services, and other health agencies to ensure the satellite emergency department on the campus will continue to uphold the highest standards of emergency care and meet all regulatory requirements. I would like to personally thank Assemblymember Breaux for his leadership in this issue and ask that you support AB 911.
Thank you. Additional witnesses in support?
My name is Bob Baker. I'm the mayor currently of San Clemente, and the citizens of San Clemente would like to thank Chairman Bonta, Assemblymember Ridley Thomas, and Senator Hernandez for coming down to visit us in San Clemente and seeing our problems up close and personally. That meant a lot to the residents of San Clemente, sir. Thank you very much for that. We also want to thank Assemblymember Bro for taking the lead on this and helping out the city of San Clemente. And also, this carries over into Dana Point, San Juan Capistrano, Mission Viejo, and the other areas in South Orange County. That's why this bill is so important. We urge you to vote in favor of this bill to ensure quality health care in San Clemente. As we all did our research on this issue, we all came across lots of numbers. We talk about hundreds of thousands of people that drive by. We have a couple 100,000 visitors in the summer. There's a lot of numbers involved in this research. But the number that really stood out to me is the increase in mortality when you close down a hospital or an emergency room. Those numbers are 5 to 15% increased mortality. That's the number that I think is crucial to understand. That's a big number for a big county in California. Hospitals, as I'm sure Tony would agree with, would do anything in their power to decrease mortalities by 5 to 15%. That would be a huge deal. That would be a very large issue. So to have something that increases mortality is, to me, counterproductive. This bill doesn't change things statewide. This is site-specific to the city of San Clemente and our hospital there. So I urge you to remember 5 to 15% increase in mortality and support this bill. Thank you very much.
Thank you. Additional witnesses in support?
Good afternoon, members of the committee. John Moffett on behalf of the Orange County Fire Authority in support.
Additional witnesses in support? Seeing none, witnesses in opposition?
Mr. Chair and members, Stephanie Roberson here in opposition to AB 911. As you know, an interim hearing was called on the issue where stakeholders could ask questions of the proponents of the measure. In that meeting, CNA had further concerns of the proposal of a standalone ER model in California. With respect to this model, there were insufficient answers as to how blood would be stored and delivered to the standalone site. As you know, to have a full service and appropriately licensed ER, you have to maintain 6 essential services, a blood bank being one of them. In addition to this particular area of Orange County, there are many thriving hospitals located within close proximity, Laguna Hills being one of them, and according to their own words, Laguna Hills is better equipped to deal with their sickest patients. At best, Saddleback should operate as an urgent care center where they're not putting patients at risk. Furthermore, as a state, we need to look at all of the hospital closures, medical redlining, and other issues that are truly at the heart of this matter. CNA urges your opposition to this measure. Thank you.
Mr. Chair and members, Michelle Cabrera on behalf of SEIU California. We also have looked at this matter more thoroughly during interim study and frankly come up quite perplexed with the need for this bill. When we pulled the most recent financial data regarding this hospital, we found that their profit margins were at 9% in a state where the average is 2.6%. And this is for both hospitals operated under Memorial Care in Orange County. We found that their Medi-Cal payer mix was 2%. So arguments that this will somehow serve the underserved in this community are overblown at best. This is a nonprofit hospital corporation running these 2 facilities with profit margins that most hospitals in the state would be envious of, with very little Medi-Cal and uninsured patients. And so the question that we came up with was, why is this needed? Why do the people of San Clemente feel that they have no other choice but to do a standalone ER? We are perplexed by it because certainly this hospital could uphold its charitable obligation as a nonprofit and decide to continue to operate a full functioning emergency room where no confusion exists about what services are there and that this is a true access point. Memorial Care talks about the next nearest hospital being 15 miles away. Actually, the nearest hospital is 7 miles away. It's just not Memorial Care's other hospital. There are numerous financial reasons why providers seek to establish freestanding emergency departments and no good data or research to back up this model of care as supporting better quality care, lower cost care, and better outcomes for the community, which I think is something we all strive to do in making policies. And for all of those reasons, we must regretfully continue to oppose this bill.
Mr. Chair, members, California Labor Federation, we're also in opposition and would just like to add that for consumers in this area or statewide, if they go to an emergency department, they expect it to have all the functions of an emergency department, which this freestanding ER won't. They also expect if they're going into something that's an urgent care and doesn't have all of the facilities that make it an emergency room, that they will be charged the copay for urgent care, not the copay for an emergency room, which is more expensive. So for consumer protection, we would urge a no vote. Thank you.
Thank you. Additional witnesses in opposition? Okay, see none. Any questions or comments from members of the committee? Mr. Lackey.
Yeah, I have a comment in the fact that I do believe that there is a statewide problem for access to emergency rooms. I can tell you in my own district, in the rural part of our county, if you're at the northeastern end, you're 60 minutes away from an emergency room. That's unsatisfactory, and it's a threat to our public. And standalone emergency rooms may not be the answer, but we need some solution, and I'm not sure what it is. So I appreciate the fact that this has at least brought this issue to the forefront. It is an issue that we really do need a statewide solution. I hope that this brings this particular issue to the forefront.
Thank you, Mr. Lackey. Mr. Rodriguez.
Can you hear me? Okay. So I know we've talked about this issue before. I think we discussed it last year, and you're looking to revisit. So just want to get a couple things clear. So this would you're looking at a freestanding emergency room only, correct?
That's
just basic emergency care, correct?
Yes. In Memorial Care's new proposed facility.
Okay. Would this be also a paramedic receiving hospital? Could anybody answer that?
That would be our intent, to continue to meet the criteria to be a paramedic receiving center, which have additional criteria on top of what's designated through the state.
Okay. So, and just to let folks know my background in EMS, first responder. So, say I happen to pick up a patient, there was a STEMI patient that we see needed cardiac cath. Would it be able to go to that hospital?
Typically, those patients right now don't come to our emergency room. They are sent to the closest cardiac receiving center, which is approximately 8 to 9 miles up the road.
So that would be the next closest hospital?
Yes, and they currently go there right now. Now, we do get walk-ins that do have that, but we do diagnose, we stabilize, and we do send them to cardiac receiving centers as quickly as they're stabilized.
Now, would this be also, in Orange County, I'm not too familiar with some of the protocols, but do they also have stroke centers?
Yes, sir. Same thing. We are in a stroke receiving center, so all those patients who are having a stroke via EMS go to stroke receiving centers, same facilities up north of us. But once again, we do have strokes that do get driven in, and once again, we do the same thing. We diagnose, stabilize, and send them to the closest stroke receiving center.
And then my next one, would this also be a pediatric care, like an EDAP facility that would be able to handle pediatric patients?
We currently don't have those capabilities today.
So that kind of goes to my point, as there would be a misconception with folks thinking this freestanding ER would be able to handle any emergency, but in this case it wouldn't. I just talked about 3 different cases where very severe cases that happen on a daily basis with cardiac patients, stroke patients. I think those are 2 very common things we see in the field every day. So that way the layperson would know, would drive there, and guess what? Now we got to call an ambulance to pick you up from that emergency room to take you to that next hospital that's the 8, 10 minutes, 15 minutes away. So I see what you're trying to do, but there'll be a false sense of security out there with the regular layperson knowing that this really isn't a fully functional emergency room, because you just stated that all we can do is stabilize them. And guess what? We got to call an ambulance that's going to delay treatment, so to speak, because if you call that 911 service, we're there in the first few minutes, whatever, 5, 6 minutes, whatever it is. We treat you, evaluate you, or you know what, you need that specialty care. We're going to take you straight to that hospital that's 10 minutes, 15 minutes away. I'm not sure the other hospital name of it, to get you cared for, versus going to that hospital. You're going to get delayed. Yeah, they can stabilize you best they can, but still, it's still not going to be good enough. And guess what? Now you got to call that ambulance to come, pick the patient up, transport them. So I'm seeing there is a delay, which you may see it that it's not a delay, but in my point, it will be, because we could have already had that patient to that stroke center, to that STEM and receiving facility, or that place that able to take care of that pediatric patient. So I know it's an issue we're looking at throughout the state. One of the areas I work in, the closest hospital is a 15, 20-minute ride. That's just for our ER. Trauma is about half an hour drive. So it is an issue, but unfortunately, I don't see this as something in that area that will be something that would be sufficient, because, once again, it's a false sense of security for the members of the community. I would more like to encourage maybe urgent care centers to do that basic stuff, and that way we can talk to folks about the importance of the hospitals nearby, which, as I said, it's 10-minute drive or whatnot, whatever the case may be.
The only issue is the next hospital is Mission Hospital, which is our regional trauma center. They're often on diversion, but it's 8 minutes away in an ambulance. Mm-hmm. It's not 8 minutes away on the freeway. If you're being transported, it's 8 minutes from the San Clemente Hospital. Mm-hmm. So, I mean, that's life or death in some situations. I understand your concerns, and also with the opposition, we worked all year on this, and I appreciate them being involved. I understand their concerns, but this has been a work in progress, and really we're just trying to find a way to keep their current ER open in a new facility they want to build.
Yeah, and I appreciate you bringing it forward in the discussion, but the way it's written, the way we're looking at it, and I can support it as it is today. But I know we can continue the discussion. Hopefully, we'll come up with other alternatives that could really take care of the patients that need the care. Thank you.
Thank you, Mr. Rodriguez. Mr. Patterson, and then Mr. Chavez.
Would you define for me stabilize? When you have people come into that hospital, they become stabilized. To me, that's you're getting into a place where you're saving their life.
Well, I'd like to clarify a little bit. So we currently don't offer cardiac interventional services nor stroke interventional services at our hospital today. So someone comes in with a heart attack, we can't treat that patient. Today, in our current emergency department, we don't have a cardiac cath lab. If a patient comes in with a stroke, we don't have the neurointerventional opportunities to help that person reverse the process of the stroke. So currently, those patients who show up today in our licensed acute care hospital emergency room aren't being treated there. They are being transported, typically by our own internal transport program, which we pay for, the patient doesn't, and we get them up to the closest facility and where they are treated and their intervention can begin. So that's what I say stabilizes. We diagnose they're having a heart attack, but if they need cardiac intervention like a cardiac cath or a stent being placed, then we have to send them to a receiving center, which we have to do today. So that won't change what we currently have on our campus today. So patients won't be changed as far as the care they receive if they show up to our emergency room.
Thank you. Appreciate that.
Mr. Chavez?
Thank you. As you know, I border you, and as you also know, in San Clemente, there's a large military population that works at Camp Pendleton, that's in the active duty in the military, actually lives in San Clemente and your area we're talking about here. And you also know that for the past 20 years I've been involved down there, one of the biggest issues we're looking at is actually the development of roads, more arterials to reduce the traffic. Right now, on many days, just the ability to get through San Clemente from Camp Pendleton up north is sometimes, a half hour, 45 minutes because of all the issues about increasing the roads. So I hear about this requirement, need by the community all the time. Just share that with you. And so we have many military and veterans who actually need that and you say, well, you go to Camp Pendleton, their Navy hospital is, 20-some miles south. So this is something that's important to the veterans and military of that area, and they would like this. They would like this. So as far as a clarification, I'm reading this report here. It says that Saddleback is part of a nonprofit Memorial Care health system. Saddleback and Memorial Care have worked over the last decade to transform their services from an acute care hospital-centric delivery system to a population of health-based delivery system. What's the health-based delivery system from the acute care hospital-centered delivery system? What does that mean?
It's a complicated question, but the quickest answer to that is going from a sick care system to truly a health care system where we're actually rewarded to keep people healthy as opposed to being rewarded for treating people when they're sick. So we are being incentivized, whether it's our 30-day readmission rate or things like that, to actually keep people healthier and keep them out of our hospitals as you know, as part of the ACA that's been passed.
So is this center here, is it all part of this program we're doing that you're trying to put in?
It would be the cornerstone of a program like that.
So I would just like to highlight that fact. I understand, you know, often when we look at the state of California, if you go off to, you know, Redding or some other places, you know, often we find people that don't have the same healthcare system. But this is a very important area for me because, one, it's dense. Two, there's a lot of military there. And I joined that. In fact, I actually have a couple of precincts in San Clemente. So I would ask that everybody think about your veterans and those who are serving in the military and support this. So thank you.
Additional comments or questions from members? Mr. Ridley Thomas.
Yes, Mr. Chair. Mr. Bro came down and visited, was one of the people who wanted to see this issue teased out a little more. I'm not sure where the dialogue has been, but I don't know if we have the votes to get it out today, Mr. Bro.
I understand
and
that.
I wish that we did, frankly. If it does not get out, I want to work with you closely and members of the committee to figure out some of our emergency room delivery issues, emergency medicine delivery issues in California. In Los Angeles, the issues are a little different, and we've discussed that, and I think members of the committee are pretty familiar with it, but just a New Year's refreshment. We need trauma care in Los Angeles County. We're looking at two sites, well, at least the county is, in Pomona and in southeast Los Angeles. And it was my thought that this and other issues related to the delivery of emergency medicine and even urgent care might have enough of a nexus that we could work on these things simultaneously. It appears that this bill that we have currently is unable to get the support. I wish that it was. I'm going to move the bill if it hasn't already been moved, and let you know that regardless of what happens here, that we are going to figure out a way to deal with these issues. And I think that the stakeholders who are here, I hadn't heard their presentation at this moment, but just in general, that they are good faith actors in the healthcare system, and they want to see an improved delivery of care. They speak from a specific perspective in terms of those whom they represent, but you know that they care about the delivery of healthcare services. And I wish that AB 911 was already ready and could get over the hump, but it's unfortunately not always the case.
Understand, and in my opening comments, I thanked you personally for coming down there. I really have enjoyed us working together on this, and I think we'll get there. And even later on, even though the opposition is opposed to the bill, they have been a part of the coalition of this year-long negotiation, and I know everybody's committed to trying to find solutions to issues like this. So I appreciate your help and look forward to continuing our work together.
We do have a motion and a second. Any other additional questions or comments from members? So I'll just make a few brief comments myself. First, Mr. Bro, I just want to thank you for being the champion that you are for your community and bringing this issue forward, for the collaborative approach that you have engaged in as you try to address this problem that you see in your community. I just really think you're a true champion for your community, and I really appreciated the invitation to go down to San Clemente and spend some time and have a constructive dialogue. And it was very warm, and we had a nice open dialogue. And so I appreciate that, and I do understand and sympathize with your and your community's concerns about the potential loss of an emergency room.
I appreciate that.
I do. I had that same issue in my own community in the East Bay. And fortunately, we were able to keep it open. We pursued a different path. It was a different solution. And maybe there's another solution here that we haven't discussed yet, because as number of the members have said today, this is an issue that is not just an issue in your community, but throughout the state, and is likely not going away. So we need to figure out a solution that can work. We're all on this committee because we're concerned about true access to high-quality health care to as many Californians as possible. And so that's our charge, and we'll continue to work on that. So again, I just want to appreciate you and your colleagues and all of the folks that you've been working with on this issue for engaging in the way that you have. So, I still have very significant concerns, and I've talked to you about those, including what medical services will not be provided on site, including the lack of on-site surgical services. There's also an open issue regarding whether patients will be charged at emergency room rates for what is not really emergency care and is more akin to urgent care. So there's some open issues, some major concerns that I have. Again, with great appreciation for your approach, your collaborative style and leadership, I regretfully have to be a no vote on this issue.
I understand. I want to thank you again for your leadership on this and working with me on the issue.
Thank you, Mr. Bro. And I did hear some ongoing interest in working on this issue, and I would like to continue to work on that as well.
That's what
so thank you. So we have a motion. We have a second. Madam Secretary, please call the roll. The motion, to be clear, is due pass to appropriations.
Bonta?
No.
Bonta, no. Mainshine? Bonilla? Bonilla, no. Burke? Burke, no. Chavez?
Yes.
Chavez, aye. Chu? Gomez? Gonzalez? Hernandez? Lackey? Aye. Lackey, aye. Nazarian? Patterson? Patterson, aye. Ridley Thomas? Ridley Thomas abstained. Rodriguez? Rodriguez not voting. Santiago? No. Santiago, no. Steinnorth? Aye. Steinnorth, aye. Thurmond? Waldron? Waldron, aye. Wood? Wood, no.
The current count is 5 aye and 5 no, and we'll leave it on call.
Thank you, Mr. Chairman and members.
Thank you.